Call upon Dr. Rosina Thomas. Yeah, please go ahead.
Good afternoon, everyone. My topic is prescribing pattern of topical antibiotics in ophthalmology. Are we doing it right? No financial interest. Acute infectious conjunctivitis is the commonest condition managed by ophthalmologists. And 70% of these cases of acute infectious conjunctivitis are viral in etiology and self-limiting. And among the rest bacterial cases, 65% are again mild and self-limiting. And there is no evidence to support the use of antibacterial medication in these cases. Prophylactic topical antibiotics have also not been proven of any benefit in postoperative endophthalmitis prevention. The aim of this study was to assess the trends in prescribing topical antibiotics for ocular surface infections and pre- and post-operative prophylaxis among ophthalmologists in Kerala and to analyze whether they are in line with evidence-based recommendations. Ophthalmologists in Kerala were invited to participate in a survey regarding their preferred practice patterns of prescribing topical antibiotics. The data obtained was statistically analyzed and the results were compared with current recommendations. 112 ophthalmologists participated in the survey, among whom 62% practiced in private institutions and 37% were from government hospitals. 45% of them were general ophthalmologists, followed by super specialists and trainees. The commonest of topical antibiotic that they prescribed was moxifloxacin, followed by ofloxacin, ciprofloxacin, gatifloxacin, chloramphenicol, and tobramycin. Doctors working in government institutions preferred ciprofloxacin, tobramycin, and chloramphenicol, whereas those in private institute preferred moxifloxacin and ofloxacin. The commonest indication for prescribing a topical antibiotic was infective conjunctivitis, followed by pre- and post-operative prophylaxis and non-specific red eyes. When asked about infective conjunctivitis, 61% of the consultants believed that most cases of acute conjunctivitis are viral and self-limiting. And 81% thought that most cases of bacterial conjunctivitis are also mild and self-limiting. But still, 82% of the consultants still prescribed a topical antibiotic for a case of viral conjunctivitis, and 91% would prescribe a topical antibiotic for a case of bacterial conjunctivitis. 86% would prescribe a topical antibiotic for a non-specific red eye where the diagnosis is not very obvious, and 74% would prescribe a topical antibiotic for a non-infective condition like an allergic conjunctivitis or a subconjunctival hemorrhage. 89.3% consultants believed that topical antibiotic had advantages like symptomatic relief, shortened course of infection, and reduced chance of recurrence, whereas 10.7% thought that it caused more of surface toxicity. 90% of the consultants would prescribe an antibiotic at the very first visit rather than wait and watch for the emergence of complications. 43% of the ophthalmologists we surveyed spent no time in patient education, which is a very important aspect of infective conjunctivitis prevention. About pre-operative prophylaxis, 50% of the participating consultants thought that a pre-operative topical antibiotic can prevent a post-operative intraocular infection, whereas the rest 50% did not think so. 92% of operating surgeons routinely prescribed a topical antibiotic. And again, the first choice of prophylactic antibiotic was moxifloxacin, followed by ofloxacin and gatifloxacin. So the ophthalmologists in Kerala, though aware of the etiological factors and natural self-limiting course, would still prescribe a topical antibiotic for a patient with infective conjunctivitis. Topical antibiotic eye drops are injudiciously used for non-infectious conditions and non-specific red eyes by a large proportion of ophthalmologists. Though guidelines recommend avoiding the use of fluoroquinolones except for the most severe infections or following treatment failure, in Kerala, fourth-generation fluoroquinolones like moxifloxacin are rampantly prescribed for uncomplicated infective conjunctivitis and non-infective conditions, especially in private institutions. Topical antibiotics are empirically prescribed at the time of diagnosis for an acute simple infective conjunctivitis rather than waiting and watching for the emergence of complications. Though preventive infection control measures like good personal hygiene and patient education is very important, about half of the participating ophthalmologists do not take time for it. Preoperative topical antibiotics for the prophylaxis of postoperative intraocular infections are used by 92% of surgeons, though no conclusive evidence supports it. To conclude, the current practice of prescribing broad-spectrum topical antibiotics by ophthalmologists in Kerala raises concerns of antibiotic resistance, cost-effectiveness, and potential increase in complications, and the rampant irrational treatment of infective conjunctivitis and other non-infective conditions with antibiotics should be checked. Use of highly effective fourth-generation fluoroquinolones like moxifloxacin should be judicious and reserved for most severe cases, and a new rational and evidence-based guidelines need to be formulated on the prescribing pattern of topical antibiotics, which are practical and cost-effective, with more emphasis on preventive aspects and patient education. My references. Thank you.
What is the total number of ophthalmologists in Kerala, of which 112 is your sample?
Actually, sir, it's around 1,200, which are in the Kerala State Ophthalmologic Society's list. And we had sent, it was done as an email survey and also as a questionnaire survey. It was initially, the emails were sent to about 1,200 ophthalmologists in Kerala, but the response rate was less. The study was done in 2016, March, April, May, and it was also our first attempt at a email survey. The response in any email survey said to be about 10%. So the response was less, and we also distributed the routine questionnaire at a few CMEs, and this was the...
No, you're painting the other 900 with the same brush.
Pardon?
You're painting the other 900 with the same brush, right?
Yes.
I think it's a very nice study because it raises a very pertinent point of indiscriminate use of antibiotics. It would have been better if you also had some study on the resistance pattern which is developing because of this, because that would have made the issue. Otherwise, they would say that it's just controlling everything.
Yes, sir. There has been a lot of microbiological studies also about the same resistance patterns that are emerging.
Because generally it's being spread that moxifloxacin is doesn't save any bacteria. I mean, everything is killed. So there is no resistance happening to moxifloxacin. But it's not true.
No,
there is already developing resistance. So that's something is very pertinent to raise such things. So we control the indiscriminate use of
yes, sir, definitely,
moxifloxacin.
Yes.
Did you also check whether these people use these drops for a specific period of time or randomly for 2-3 days and stop?
Yes, sir. This was actually part of a much larger questionnaire. I had to shorten it to the 6 minutes. The rest of the questionnaire also included questions like why, even though they are aware of the futility of...
No, I'm just checking. What was the compliance rate?
Yes, sir. We have, this is to ophthalmologists, sir.
Yes.
And the duration that they give the drugs for, the frequency that they administer drugs were all tabulated, sir. It's all there in the full paper, sir. I couldn't include it in it.
No, I'm just asking you one question. What was the compliance rate? Was it good? Did they complete the dose?
So the survey was to ophthalmologists, sir, not to...
No. But they should know, no, whether the
yes, sir. Because whenever the patient recovered, they rarely came back.
Yeah.
It is those only with complications that came back with...
Thank you.
Okay, Dr. Rosina, here. Good study. What is your setup where you work?
I work in a tertiary care center, eye hospital, sir. I'm a general ophthalmologist and a cataract surgeon. I work in the emergency department.
And what would you conclude as or what would you recommend as pre-op regime? Would you recommend that we prescribe pre-operative antibiotics for cataract patients?
Yes, sir. In our
from your study.
From the this is just a survey, sir.
Yeah, from the survey.
Yes,
the
sir.
survey has a purpose.
Yes, sir.
The purpose was to document indiscriminate use of antibiotics.
Yes, sir.
Especially pre-cataract surgery or in non-specific red eye.
Yes, sir.
Let's take up pre-cataract surgery.
Yes, sir. Topical antibiotics have been shown to reduce the conjunctival load of microorganisms, and so we would recommend an antibiotic, though there is no study to prove the effectiveness of the antibiotic in preventing a case of endophthalmitis.
So,
the simplest antibiotic that is available, but not a moxifloxacin, Because if you have already used the moxifloxacin pre-operatively, and in case you have a post-operative endophthalmitis, you have nothing more to give.
So you would recommend some other antibiotic
Yes,
rather
sir. A
than
milder antibiotic
like
like ofloxacin.